heart attacks, strokes, kidney disease. These are just some of the dangers of high blood pressure. And the worst part? Most people don't even know they have it. As we age, our blood vessels change, making high blood pressure more common after 60. But what can you do to stay safe? In this video, we will explain what high blood pressure is, why it happens with age, and why many people don't notice the symptoms. We will also share how to monitor it, important lifestyle changes, medical treatments, and when to seek help. Stay with us, it's time to take action for your health. Why high blood pressure is called the silent killer. High blood pressure, or hypertension, is known as the silent killer because it typically has no symptoms but gradually causes severe damage to the heart, blood vessels, brain, and kidneys. Many people remain unaware of their condition until they experience life-threatening complications like heart attacks, strokes, or kidney failure. Over time, untreated high blood pressure weakens arteries, making them less flexible and more prone to blockages. This increases the risk of cardiovascular disease and cognitive decline. Since hypertension often goes unnoticed, regular monitoring, a healthy lifestyle, and medical intervention are essential to prevent irreversible damage and protect long-term health. What is high blood pressure? Understanding the basics, high blood pressure, or hypertension, occurs when the force of blood pushing against the walls of the arteries remains consistently too high. Blood pressure is measured in millimeters of mercury, mmHg, and recorded as two numbers: systolic pressure, the force when the heart beats, over diastolic pressure, the force when the heart rests between beats. A normal reading is around 120/80ths mmHg, while readings above 130/80ths mmHg indicate hypertension. When blood pressure is elevated, the heart has to work harder to circulate blood, putting strain on the arteries. Over time, this weakens the blood vessels, increasing the risk of heart disease, stroke, kidney damage, and other complications. Factors such as aging, genetics, obesity, high salt intake, lack of exercise, stress, and chronic conditions like diabetes contribute to hypertension. Since it often has no symptoms, regular monitoring and lifestyle changes are essential for prevention and management. Why does blood pressure rise after 60? The aging factor blood pressure tends to rise with age due to natural changes in the cardiovascular system. As people grow older, their arteries gradually lose elasticity and become stiffer. This condition, known as arteriosclerosis, increases resistance to blood flow, forcing the heart to pump with greater force, leading to higher blood pressure. The gradual buildup of plaque in the arteries, a process called atherosclerosis, further narrows blood vessels, restricting circulation and contributing to hypertension. The efficiency of the body's regulatory mechanisms also declines with age. The baroreceptors, which help regulate blood pressure by sensing changes in arterial pressure and adjusting accordingly, become less sensitive. As a result, the body struggles to maintain stable blood pressure levels, leading to increased fluctuations and a higher overall risk of hypertension. Additionally, the kidneys, which play a crucial role in controlling blood pressure by managing fluid balance and sodium levels, become less effective with age. This can result in sodium retention, increasing blood volume and elevating blood pressure. Hormonal changes are another contributing factor. As people age, levels of hormones like renin and aldosterone, which help regulate blood pressure, decline. This can lead to imbalances in fluid and electrolyte levels, further promoting hypertension. Other age-related factors such as reduced physical activity, weight gain, and metabolic changes also contribute to rising blood pressure. Older adults are more likely to experience increased stress levels, poor sleep quality, and chronic conditions such as diabetes and kidney disease, all of which elevate the risk of high blood pressure. Since hypertension in older adults is often asymptomatic, regular monitoring and lifestyle modifications such as a heart-healthy diet, exercise, stress management, and medical treatment when necessary are crucial in maintaining optimal blood pressure levels and reducing the risk of serious complications. The silent symptoms, why you might not notice it. High blood pressure is often called the silent killer because it typically develops without noticeable symptoms, making it difficult for individuals to detect it without regular checkups. Unlike other health conditions that present obvious warning signs, hypertension progresses quietly over time, damaging vital organs such as the heart, brain, kidneys, and eyes without immediate discomfort. This lack of symptoms is why many people remain unaware of their condition until they experience severe complications like heart attacks, strokes, or kidney failure. In some cases, individuals with extremely high blood pressure may experience vague symptoms such as headaches, dizziness, nosebleeds, or shortness of breath. However, these symptoms are not specific to hypertension and can be caused by other health issues, leading many people to ignore them. Some individuals may also experience fatigue, vision problems, or confusion when blood pressure reaches dangerously high levels, but these signs often appear only when severe organ damage has already occurred. One reason hypertension remains undetected is that the body adapts to elevated blood pressure over time, making individuals feel normal despite the ongoing damage. This makes routine blood pressure monitoring essential, especially for those over 60 who are at higher risk. Regular screenings allow for early detection and timely intervention, reducing the likelihood of life-threatening complications. Because high blood pressure silently damages arteries and increases the risk of cardiovascular diseases, it is crucial to adopt preventive measures. Lifestyle changes such as a balanced diet, regular exercise, stress management, and medication when necessary can help maintain healthy blood pressure levels. Without proactive management, hypertension can lead to irreversible health problems, emphasizing the importance of regular medical checkups and early detection to prevent serious consequences. The dangers of uncontrolled high blood pressure, stroke, heart attack, and more uncontrolled high blood pressure significantly increases the risk of life-threatening conditions such as stroke, heart attack, kidney failure, and vision loss. When blood pressure remains consistently high, it puts excessive strain on the arteries, causing them to become narrow, stiff, or even rupture over time. This damage leads to poor circulation, increasing the likelihood of cardiovascular and neurological complications. One of the most severe consequences of hypertension is stroke. High blood pressure weakens blood vessels in the brain, making them prone to rupture or blockage. A hemorrhagic stroke occurs when a weakened artery bursts, leading to bleeding in the brain, while an ischemic stroke happens when a clot blocks blood flow to the brain. Both types can cause paralysis, loss of speech, and permanent brain damage, often leaving survivors with long-term disabilities. Hypertension also contributes to heart disease by forcing the heart to work harder to pump blood. Over time, this leads to left ventricular hypertrophy, thickening of the heart muscle, increasing the risk of heart failure. It also promotes the buildup of plaque in arteries, leading to coronary artery disease, which can result in a heart attack if blood flow to the heart is blocked. Chest pain, angina, and irregular heart rhythms, arrhythmias, are also common in individuals with long-term hypertension. Other dangers of uncontrolled high blood pressure include kidney damage, as the delicate blood vessels in the kidneys are unable to filter waste effectively, leading to chronic kidney disease or failure. Additionally, hypertension can damage the eye's hypertensive retinopathy, causing vision problems or blindness. To prevent these complications, managing blood pressure through lifestyle changes, medication, and regular monitoring is crucial. How to detect and monitor your blood pressure regularly. Detecting and monitoring blood pressure regularly is crucial since hypertension often has no symptoms. The most effective way is by using a blood pressure monitor at home or having regular checkups with a healthcare provider. Home monitoring helps track daily fluctuations and ensures early detection of any concerning changes. Blood pressure readings consist of systolic top number and diastolic bottom number measurements. A normal reading is around 120/80ths mmHg, while 130/80ths mmHg or higher may indicate hypertension. For accurate results, measure blood pressure at the same time each day in a relaxed state, avoiding caffeine, smoking, or exercise beforehand. Regular monitoring allows early intervention, helping to manage blood pressure through lifestyle changes and medication if needed. Consulting a doctor for professional assessments ensures proper treatment adjustments and reduces the risk of complications like heart disease or stroke. Lifestyle changes to keep your blood pressure in check. Managing high blood pressure effectively requires adopting healthy lifestyle habits that help maintain normal levels and reduce the risk of complications. One of the most important changes is following a heart-healthy diet, such as the DASH dietary approaches to stop hypertension diet. This involves consuming more fruits, vegetables, whole grains, lean proteins, and low-fat dairy while reducing sodium, processed foods, and saturated fats. Limiting salt intake to less than 200-300 milligrams per day, or ideally 100-500 milligrams, can significantly lower blood pressure. Regular physical activity is another key factor in controlling hypertension. Engaging in at least 150 minutes of moderate intensity exercise per week, such as walking, cycling, or swimming, strengthens the heart and improves blood circulation. Exercise also helps in maintaining a healthy weight, as excess body fat increases the workload on the heart and contributes to higher blood pressure. Losing even a small percentage of body weight can lead to noticeable improvements. Reducing alcohol consumption and quitting smoking are also crucial for blood pressure management. Excessive alcohol intake can raise blood pressure and reduce the effectiveness of medications, while smoking damages blood vessels and increases the risk of heart disease. Managing stress through relaxation techniques like meditation, deep breathing, and yoga further helps in keeping blood pressure stable. Adequate sleep and proper hydration also play a role in blood pressure control. Poor sleep quality and dehydration can contribute to hypertension by increasing stress hormone levels and affecting kidney function. Making these lifestyle changes, along with regular monitoring and medical guidance, can help maintain optimal blood pressure levels and prevent severe health complications such as heart attacks and strokes. Medical treatments and when to seek help. Medical treatment for high blood pressure is essential when lifestyle changes alone are not enough to control it. Doctors typically prescribe antihypertensive medications based on the severity of hypertension in individual health conditions. Common classes of medications include diuretics, which help the body eliminate excess sodium in water, beta blockers, which reduce heart rate and workload, ACE inhibitors and ARBs, which relax blood vessels, and calcium channel blockers, which improve blood flow by preventing artery constriction. These medications are often used in combination for better blood pressure control. It is important to seek medical help if blood pressure consistently measures 130/80ths mmHg or higher, especially if accompanied by symptoms like severe headaches, chest pain, shortness of breath, or dizziness. A hypertensive crisis above 180/120ths mmHg requires immediate medical attention to prevent life-threatening complications like stroke or heart attack. Regular checkups with a healthcare provider ensure proper treatment adjustments and monitoring for potential side effects of medication. Ignoring high blood pressure increases the risk of organ damage, so timely medical intervention is crucial. By combining prescribed treatment with healthy lifestyle changes, individuals can effectively manage hypertension and reduce the risk of severe cardiovascular and neurological diseases. High blood pressure may be silent, but its dangers are real. The good news? You have the power to control it. Regular checkups, a healthy lifestyle, and the right treatments can protect your heart, brain, and kidneys. Don't ignore the warning signs. Take action today. Your health is in your hands, and small changes can make a big difference. Check your blood pressure, eat right, stay active, and listen to your doctor. Share this video with your loved ones. It could save a life. Subscribe for more health tips, and stay safe, stay healthy.